The main thing though is that any knee injury becomes problematic, especially knee sprains, because when you look at the knee, if you actually look at the surface here, this tibia is flat here. Okay, the thing that actually creates the socket-like surface are these meniscus here. A lot of people think that the meniscus actually is a padding or a shock absorber. What it actually does is that these rounded condyles of the femur sit in there, and then they glide back and forth as the knee bends. Okay, but the point being is that the anatomy doesn't create great geometry for stability. Like you have the ball and socket joints, well, even the shoulder's not very good with that. The hip would be the better example of how that socket sits, or the ball of the femur sits deep into the socket like this. Well, in this case, the knee is basically like two surfaces floating across each other this way. Well, what keeps everything together is all this connective tissue that holds it in place. And so anytime that you get a tear to one of these ligaments or something like that, it really causes a major problem in terms of our ability to move, because it creates so much instability there. Versus an ankle sprain, which I talk to people about this all the time, there's no difference between spraining your MCL and spraining your ankle, really, from the way that the tissue heals. It's just the main difference is that the congruency of the geometry of the ankle allows you to function afterwards. You sprain your ankle and you can continue to walk around because the talus is sitting up in the mortise between the fibula and tibia, and so that allows the ankle to stay stable. Whereas if you sprain your knee in any of the ligaments, it automatically becomes unstable because it already has so much. In terms of the shape of the joint, it has a poor quality to it, so it needs all these soft tissue structures to really hold it in place. And it also needs the muscles to function on all sides and be firing in the right patterns. So if you can imagine, if you had 4 columns of muscles around here, they all need to be firing at the same time to keep a really good contraction to keep this stable, is which we call dynamic co-contraction between the quadriceps and the hamstrings. And also you can't forget about the muscles behind from the calf muscles that help to stabilize back there as well.